What is pneumonia? A simple question with a complex answer. Pneumonia is an infection that takes hold in one or both lungs, and it's not picky about its culprits. It can be caused by bacteria, viruses, or even fungi. Once these invaders settle in, they trigger inflammation as your body mounts a defense. This battle causes your air sacs, those tiny structures in your lungs where oxygen and carbon dioxide trade places, to become inflamed and fill with fluid. It's a bit like a water balloon filling up inside your lung. This fluid not only makes it harder for oxygen to reach your bloodstream, but also creates that characteristic cough that is often associated with pneumonia. But don't be fooled. Pneumonia is more than just a bad cough. It's a serious condition that can be life-threatening. It's not just a nuisance, it's an invader, a disruptor, a potential killer. Pneumonia is more than a bad cough. It's a serious condition that can be life-threatening. What causes pneumonia? To answer this question, we need to dive a little bit into the world of microorganisms. Pneumonia is an infection that inflames the air sacs, or alveoli, in one or both lungs. It can be caused by a variety of organisms, including bacteria, viruses, and fungi. Let's start with bacteria. The most common cause of bacterial pneumonia in adults is Streptococcus pneumoniae, also known as pneumococcus. This bacterium is usually found in the upper respiratory tract and can invade the lungs when your immune system is weakened or if you inhale large amounts of the bacteria. Next, we have viruses. Viral pneumonia is most often caused by the influenza virus, but it can also be caused by other viruses such as the respiratory syncytial virus, or RSV, and SARS-CoV-2, the virus that causes COVID-19. Viral pneumonia often starts off as a common cold or the flu, but if the virus reaches the lungs, it can cause pneumonia. Last but not least, fungi. Fungal pneumonia is less common and typically affects people with weakened immune systems or those who inhale large amounts of certain types of fungus. The types of fungi that can cause pneumonia vary depending on the geographic region. So how do these microorganisms enter the lungs? The most common route is through airborne droplets that are expelled when a person with pneumonia coughs, sneezes, or talks. These droplets can be inhaled by people nearby. Pneumonia can also be contracted by touching a surface contaminated with the bacteria, virus, or fungus, and then touching your mouth, nose, or eyes. But it's not just about exposure. Other factors such as age, immune system strength, and overall health also play a significant role in determining whether someone develops pneumonia after being exposed to these organisms. In short, pneumonia can be caused by a variety of organisms and is often contracted through airborne droplets or by touching contaminated surfaces. Knowing the causes of pneumonia can help us take preventive measures. Recognizing the symptoms is crucial. So, what are the symptoms of pneumonia? Pneumonia is a silent attacker, often mistaken for a common cold or flu, but its symptoms, although common, are more severe and persistent. Let's delve into the common symptoms one might experience when dealing with this condition. The most common symptom of pneumonia is a persistent cough. This is not your average cough. It's often accompanied by the production of green, yellow, or even bloody mucus. This symptom alone can leave you feeling exhausted and weak. Another symptom is a high fever, often accompanied by chills and sweating. The body's temperature rises as it attempts to fight off the infection. If you notice a fever that's unusually high or persistent, it could be a sign of something more serious like pneumonia. Difficulty breathing is another common symptom. You may find yourself short of breath even when at rest or performing simple tasks. This is due to inflammation and fluid buildup in the lungs, which can make it hard to take deep breaths. Other symptoms include chest pain, especially when coughing or breathing, confusion or changes in mental awareness, fatigue, and loss of appetite. In severe cases, you may also notice a bluish color in lips and fingernails, signaling a lack of oxygen in the blood. Children and older adults may show different symptoms. Infants might vomit, have a fever and cough, appear restless, or have difficulty eating or drinking. Older adults, on the other hand, might have milder symptoms or they may even be absent. They might experience confusion or lower than normal body temperature. Not all these symptoms need to be present for pneumonia to be a possibility. If you or anyone you know are experiencing any combination of these symptoms, especially if they are severe or persistent, it's important to seek immediate medical attention. Remember, pneumonia is a serious condition, and early detection can make all the difference in treatment and recovery. If you or someone you know experiences these symptoms, immediate medical attention is vital. How does a healthcare professional diagnose pneumonia? It's a question that many of us may have pondered at some point. After all, pneumonia is a common ailment, affecting millions worldwide each year. Understanding how it's diagnosed is key to early detection and treatment. The first step in diagnosing pneumonia often involves a physical examination. Your doctor will listen to your lungs using a stethoscope. If you have pneumonia, your lungs might make a crackling, bubbling, or rumbling sound when you inhale. They'll also check your heart rate and temperature, as pneumonia can often cause a fever and a faster than normal pulse. Next, a chest X-ray may be ordered. This imaging test provides a clear picture of your lungs and can help your doctor see if there's any inflammation or fluid, which are telltale signs of pneumonia. It can also show the location and extent of the infection. Blood tests are another common method used to diagnose pneumonia. These tests can confirm an infection and can also help identify the type of organism causing the infection. This information is vital as it helps your doctor choose the right treatment for you. Lastly, you might be asked to provide a sputum sample, which is essentially mucus that you cough up from your lungs. Analyzing the sputum can also help identify the cause of the infection. In some cases, additional tests may be needed, especially for those with severe symptoms or for individuals who are hospitalized or have a weakened immune system. These could include a CT scan of the chest or a bronchoscopy, where a thin, flexible tube is threaded down your throat and into your lungs to visually inspect them. Pneumonia can be a serious condition, but with the right diagnosis, it can be treated effectively. Remember, if you're experiencing symptoms such as a persistent cough, chest pain, fever, and difficulty breathing, it's important to seek medical attention immediately. Early diagnosis can make a significant difference in the treatment and recovery from pneumonia. So, don't hesitate. Your health is worth it. What are the treatments available for pneumonia? That's a question we're going to delve into now. Pneumonia is a versatile adversary, manifesting in a variety of types and severities. This means that treatments must be equally dynamic. The most common weapon in our arsenal is antibiotics. These are typically prescribed for bacterial pneumonia, which is the most common type. The exact antibiotic chosen will depend on several factors, including the patient's age, overall health, and the type of bacteria suspected to be causing the pneumonia. In the case of viral pneumonia, antiviral medications are often the go-to treatment. While viral pneumonia can sometimes resolve on its own, these medications can help to speed up the recovery process and alleviate symptoms. But what about more severe cases? Sometimes, pneumonia can become so severe that hospitalization is required. This is particularly true for older adults, infants, and people with other serious illnesses. In a hospital setting, treatment may include intravenous antibiotics, respiratory therapy, and oxygen therapy to ensure the body gets the oxygen it needs. Pneumonia can also lead to complications such as lung abscesses, where pus collects in the lung, or pleural effusion, where fluid builds up around the lungs. These complications may require additional treatments like draining the fluid or even surgery in some cases. Remember, the key to effective treatment is early detection. If you're experiencing symptoms that suggest pneumonia, such as a persistent cough, fever, and difficulty breathing, don't hesitate to seek medical advice. And of course, while we're focused on treatment, we shouldn't forget about prevention. Regular hand washing, vaccinations, and maintaining a healthy lifestyle can all help to reduce your risk of pneumonia. So, whether it's antibiotics, antivirals, or hospitalization, there are a host of treatments available that can help you combat pneumonia. It's a tough opponent, but with the right treatment and care, it's one that can be defeated. The right treatment can help you recover and prevent complications. So make sure you're informed and ready to take action if pneumonia strikes. Let's wrap up what we've learned today. Pneumonia is a serious condition that affects the lungs, caused by various agents such as bacteria, viruses, and fungi. It's a health concern that can affect anyone, regardless of age or health status. We delved into its symptoms, which can range from mild to severe, including cough, fever, difficulty breathing, and chest pain. These symptoms may not always be present or may appear differently in each individual, making diagnosis a crucial step. Diagnosing pneumonia often involves a physical exam, medical history, and possibly imaging tests. Treatment, on the other hand, depends on the cause and severity of the condition. It might include antibiotics, antiviral medication, rest, and hydration. The importance of seeking immediate medical attention if you or someone else is showing severe symptoms cannot be overstressed. Early detection and treatment can significantly improve the prognosis. Keep these points in mind and remember, your health is a priority.